Welcome everyone to Talk Crafted English. Today, we're bringing you into a real-life clinic visit. Dr. Patel, how do patients typically greet their doctor in English?
Great question. Most patients start with a simple hello, doctor, or good morning. It's polite and sets a friendly tone. For example, Nina might enter and say, "Hello, Dr. Patel. Thank you for seeing me."
And on the doctor's side, what's a good way to respond?
A warm reply works best. "Hello, Nina. It's nice to meet you. How can I help you today?" This opens the conversation and makes the patient feel comfortable, which is essential, especially for English learners.
Now that our characters have greeted each other, let's move on to describing symptoms. Dr. Patel, what phrases are most useful here?
Patients often use I have plus the symptom. I have a sore throat or I have a headache. For ongoing issues, present perfect is common. I've had a cough for 2 days. These patterns help make explanations clear and direct.
Could you give an example dialogue using both present simple and present perfect?
Certainly. Nina could say, "I have a fever and I've had a sore throat since yesterday." This tells the doctor both what's happening now and how long it's been going on.
Let's delve deeper into how long symptoms have lasted. Why is specifying duration important, especially in English consultations?
Duration helps doctors understand if an illness is acute or chronic. Saying, "I've had a cough for 2 days," signals a recent issue. "But I've had headaches for months," could suggest something more serious.
How might a doctor ask about duration in simple terms?
Doctors often use, "How long have you felt this way?" or "When did your symptoms start?" These questions encourage patients to use present perfect tense, practicing real-world English grammar.
Expanding our vocabulary, what are some common symptoms every English learner should know?
Essential words include fever, cough, sore throat, runny nose, and headache. For body parts, terms like throat, head, and chest are vital. For example, "My chest hurts when I cough."
Are there any other useful expressions for describing pain or discomfort?
Definitely. Phrases like "I feel dizzy," "I'm sneezing a lot," or "I have chills" help paint a clearer picture. These expressions make the conversation more precise and effective.
After hearing about symptoms, what kind of follow-up questions does a doctor usually ask to get more information?
Doctors often ask about severity and additional symptoms. Is your fever high? Or do you have any other discomfort like headaches or nausea? This ensures nothing important is missed.
How can patients answer these questions effectively, especially if their vocabulary is limited?
Simple, direct answers work best. "It's a mild fever," or "No, just a sore throat." Using adjectives like mild, severe, or constant helps provide clear descriptions even with basic language.
Let's transition to the advice stage. When a doctor gives instructions in English, what phrases should patients listen for and understand?
Common advice includes, "You should get plenty of rest," "Drink warm water," or "Take this medicine twice a day." These imperative sentences are easy to follow and crucial for recovery.
What's a good way for learners to check their understanding of these instructions?
They can repeat the advice, "So, I should rest and drink water." Confirming instructions not only clarifies meaning, but also builds confidence in using English in real situations.
Politeness is key in any medical setting. What are some ways patients can show respect and doctors can offer reassurance in English?
Patients can say, "Thank you for your help," or "I appreciate your advice." Doctors might respond, "You're welcome," or "Let me know if you need anything else." These phrases foster a supportive environment.
How can learners practice these expressions for fluency?
Repeating these phrases aloud or role-playing with a friend helps internalize them. Polite language is as important as medical vocabulary in building trust and rapport.
A recurring challenge for English learners is understanding spoken instructions and pronouncing medical terms. What strategies can help with these skills?
Listening to slow, clear English like in this podcast is invaluable. Breaking down complex words, such as prescription, into syllables can aid pronunciation. Prescription. Repetition is key for both skills.
Does shadowing the doctor's advice help as well?
Absolutely. Shadowing repeating right after you hear a phrase improves both listening and speaking accuracy. It's like training your ear and mouth together for real-life conversations.
Let's move on to active practice. How can learners use role play to prepare for real doctor visits in English?
Role-playing as both patient and doctor helps reinforce vocabulary and sentence patterns. For example, try saying, "I don't feel well." "I have a headache." Then switch roles and give advice like, "You should rest."
Are there structured activities that boost confidence further?
Yes, practicing with a partner or recording yourself answering common questions like, "How long have you been sick?" lets you identify areas to improve, making you more comfortable in real situations.
To wrap up, let's introduce today's speaking challenge. Dr. Patel, what should our listeners try to practice right now?
Describe how you feel using at least 3 symptoms. For example, "I have a sore throat, I'm sneezing a lot, and I've had a headache for 1 day." Try to use both present simple and present perfect tense.
That's a fantastic exercise for solidifying today's lesson. Listeners, feel free to pause and repeat after us for extra practice.
Absolutely. Practicing out loud builds muscle memory and confidence. Remember, the more you use these phrases, the more natural they'll feel in real conversations.